to be here. I'd like to take you a couple of notches down and just talk to you about how AI will disrupt healthcare and how it is actually disrupting healthcare and how it is disrupting drug discovery. Now, let me reassure everyone in healthcare here in the room, you still have a job. We need you. You're not going anywhere. But as we have been talking about change since this morning, as we've done in healthcare, we will have to evolve, no choice. We are evolving. And if I look at the space, if you will, of AI applied to healthcare, there are 4 big buckets, and that's probably the simplest way of describing it, right? The first bucket seems obvious. It's anything that has to do with administrative simplification. Okay? Doesn't sound terribly sexy. It doesn't sound terribly interesting because it's kind of administrative stuff. But listen to this, okay? In this country, we spend $4 trillion on healthcare, with a T, trillion dollars, okay? Now guess what? 25% of these $4 trillion, $1 trillion, is spent not on healthcare providing anything. It's spent on administrative stuff. So there is some work to do. Interestingly enough, we talk about countries like Canada, where you have one payer, countries in Europe, where you have one payer. Do you know how many payers we have here in the US? Any number, any idea? We have about 900 payers here in the US, okay? And the system is benefiting. They're not here by haphazard, they're making money. So one of the clear application of AI, frankly, is to disrupt this administrative nightmare that we have. And it seems that if we apply only 30 AI technologies, only 30, we can save up to $300 billion a year, $300 billion a year. And here in the room, we have Amal Najjar, who is doing exactly that with her new company, MedGeo. So it's not tomorrow, it's today, it's happening. And she will disrupt this administrative burden that we have. The second big chapter is something that you're hearing about. It's called precision medicine. And precision medicine is simply the fact that today, we're starting to have the tools to treat one patient at a time. So you heard about gene therapy. In gene therapy, we literally treat one patient at a time. I serve on the board of Moderna, and you heard about Moderna with the vaccine and everything. But today, a couple of months ago, we published a very, very interesting result on something called personalized cancer vaccine. And personalized cancer vaccine is a treatment that is developing, leveraging AI applied to one patient with melanoma. And the results are flabbergasting because we were able to reduce the repeat of melanoma by about 40%, okay? And it's one patient at a time. Now, the challenge of this is who would pay for this because these treatments are not inexpensive. But this is where we're heading. And if we expand beyond one person to a population that we can define by age, by gender, by geography, by race, by family history, by immune profile, by metabolic profile, microbiome, and everything, we are today in the process of developing a medication for you as a person. When I started in this business, we developed medications for hundreds of millions of people, and we did not touch anything small. Then my career shift, and I focused on rare diseases, where with one of the products I helped to develop, we have only 5,000 patients in the US. And we developed, now we're zooming even further, and with time we're seeing it, it's not far away. we will develop treatments for one patient at a time. But at the same time, one of the pivotal things that we need to do that is something called genetics-based solution, okay? So all the assays, all the assessments that we'll have. So, and Salma, your word as a geneticist is changing, will continue to change, simply because AI now is an intricate part of what you do every day, and this will continue. And this is what we heard earlier. We're not replacing anyone. We're enhancing what we're doing because we have so many different tools. Now, the third big chapter is something called medical visualization. So we heard about the microscope. So if we expand the notion of microscope, and now we have competition for you, Hazem, as well. As you all know, Hazem Shahabi is a nuclear medicine physician, board certified. But it's interesting because in this field of medical visualization, AI made terrific progress. So what happened recently, and Hazem, you might know about that, is there was a study conducted by NIH, actually, conducted by Google, sorry, not NIH, using NIH data, when they looked at about 45,000 CT scan lung in search of lung cancer and compared what a deep learning machine can do versus 6 radiologists. Results were amazing because the AI scored correct 94.4% of the time. It saves about 11% of false negatives and 5% of false positives. Think about this, 11% of false negatives, people who would have lung cancer, not know that. False positive, people who thought they had and they did not have. Now, how would this integrate with what our colleagues are doing? It's an integration because we will learn to live with, learn from, teach to, and grow with. Now, let me come to the area of drug discovery, gigantic. So when you are injected, some of you have been injected with a COVID vaccine, whether it's Pfizer or Moderna. Where did it come from? All our machinery behind the scene is AI-driven. And this is why Moderna and Pfizer were able to put together a vaccine in about 3 weeks. Certainly, we did not use the old traditional, which would have taken 3 years. We did not have 3 years. Right? So the AI was kind of the backbone behind sequencing the DNA, sequencing the RNA, and developing the vaccine. So let me tell you a story. At the same time, my world conflicted, and because I was with Benevolent AI, and our CEO went to Singapore just on a fundraising. And Singapore back then, early in 2020, had a they were overwhelmed with COVID, right? And one of our investors said, could you do something for us? Could AI do something for us? She came back, and with the help of our scientists, we asked the question, is there anything specific in this virus that we can tackle? Within 48 hours, our scientists discovered that there were some very specific genome sequencing in this virus that we can tackle to treat and cure. And the second question was, is there anything out there that can do that? Okay? And with the help of AI, they scouted the whole universe of every possible drug that is on the market today, everything. And they did it within days, which would have taken years, if ever, to do it. Interestingly enough, they came up with an answer. And the answer was a drug called baricitinib. Okay? You probably never heard about it because this is a drug that is produced by Eli Lilly for rheumatoid arthritis. Nothing to do with COVID whatsoever. So what the team did is they published the results in Lancet within 3 weeks, which is one of the top medical journals, And they called Lilly. They said, hey, guys, we have something for you that could actually treat COVID. And Lilly said, who are you? Are you kidding me? We know better than you do. Meanwhile, there was a group at Emory that has been working on this drug for 15 years and did not think for a second that it could work in COVID. AI did it in 3 days, okay? So what happened is we contacted the NIH, and the NIH was interested, and they ran a study on this drug. Funny enough, the lead investigator of the study, his name is André Khalil, just another Lebanese from Brazilian origin. André Khalil is the lead NIH investigator for anything infectious disease and COVID. And then Lilly woke up eventually and took this drug and marketed it after the FDA approved it. Interestingly enough, and see the results are flabbergasting, because once the drug was approved, then we continued doing a study. And listen to this, a drug that was originally designed for rheumatoid arthritis, okay, reduced mortality by 46% in 28 days, 46%. So we saved half of the patients from dying, you know, and that was the result, and the rest is history. The nice thing about Benevolent is they did not want to make money out of this, and they offered it for free to Lilly. Interestingly enough also, and to your question about ethics over there, that's an amazingly important question. And guess what we did at Benevolent? We recruited an ethicist from Stanford to sit on our board, because we needed to make sure that ethics and science work hand in hand. All right? So we have now an ethicist sitting on our board. Now, where from here? Okay? Where from here is very simple. We have experts predict, and experts being Harvard and McKinsey, predict that the AI will add $16 trillion to our economy in 2030. It's expected, today it's around $15 billion as a market, expected to go to $100 billion by 2028. And it could save the US about $400 billion if it is adopted. And then where from here today and tomorrow and the day after, and I was struck by a concept called singularity. Do you know what singularity is? Well, you should, because singularity is a concept that says that at some point, AI and the machine will be smarter than we are, okay? And guess what? As you all know now, Sasha, our grandson, is here in the room. He wants to hear Jiddo speak. Sasha is 7.5 years old. In his time and age, singularity will be with us. So Sasha will live at a time where machines will be smarter than we are. The question is, what is it that we will do about it? What are the ethical questions? What are the practical questions? What I learned from a long time is if you cannot beat them, join them. And what we'll see most probably in our lifetime or in the lifetime of our kids and grandkids is this fusion between us as human beings and our technology that we develop. Thank you very much.
Thank you so much, Dr. Nader, for explaining the positive role artificial intelligence can play in the healthcare field, namely by accelerating innovation and increasing the probability of discovering successful drugs. Do we have any questions from the audience?
Yeah, Tony.
So I agree with you about the AI and the power of AI. The problem is that what we're going to be facing is the critical thinking of humans. That's going to be depleted. I'll give you an example. We're doing 2 studies on AI now with the radiology, actually, how to read spinal fusions and how to read spinal instability. So it's basically based on data points, and then you give it to the computer with the consensus, and this is what we think, this is fused, this is we think not fused. But once that computer learns, and I agree with you, it's going to be smarter than us. My problem is that the next generation, that they're not going to know how to connect the dots to know that this spine is fused or this spine is unstable, so that you're going to get the results. So talking about the mammals and talking about the pathology, which is our great applications for AI, the problem is that what if that computer is wrong? So if we did not learn, I give you simplify it. If I'm always in the time in the car, which is self-driving car, and I'm going to go drive, I'm going to be a very bad driver.
You're absolutely right, and I have 2 answers for you. Education has to change, because we'll have to learn different things. But also, would our brain function evolves as well? Because now what you're thinking is critical thinking, and how we distinguish right from wrong. And I'm just wondering, and it's a question, frankly, is whether or not the way we think will evolve at the same speed as the machine will evolve. And the answer is probably not at the same speed, but we don't have a choice. You know, that's with every disruptive technology. We could never think in a minute that a 3-year-old could use an iPhone, yet they do, you know? So how will evolve, I don't have any idea, but we have to. Please.
Thank you for what you do in developing personalized cancer treatment. I'm an oncologist and passionate about cancer development, treatment development. The question I have for you is that less than 4% of adult patient goes on cancer trials, and AI is definitely going to revolutionize new drug discovery, but we're still going to have this bottleneck. Can you comment on how AI is going to help bring this treatment to patients? Because ultimately, we're not going to be able to find if they are going to cure cancer without doing clinical trials.
Because of time, I did not expand, so I have 2 answers for you. In our portfolio at Benevolent AI, we're working on a treatment for glioblastoma. As you know, there is no treatment. And it's coming from computers. So we say now, instead of bench to patient, we say computer to bench to patient. The issue you're raising is a very important one, is the issue of awareness and access. Awareness about clinical trials and how we can continue to simplify our clinical trials. Most patients don't want to be in a clinical trial because it's too complicated, right? Many physicians don't want to embark and do clinical trials because it's too complicated. We just pulled the plug on a fantastic technology with another company simply because we could not enroll. The regulators are such that it was virtually impossible to do it. And it was for a technology that will enable patients who go through a kidney transplant to live the rest of their life without immunosuppressant. Life-changing. Could not finish it because of enrollment. That's a critical, and I think the answer is access. The answer is regulation. And the answer, frankly, is how to do good science with less. Now, with adaptive trials and AI, we are able to do that. AI today is helping us in patient selection. So instead of looking at 1,000 patients and try to pare them down, we can target the 50 patients that we need. And that's certainly a plus because the probability of success is much higher. Again, patients don't like to participate in clinical trials because, well, I'm not sure that it will work for me. And they're absolutely right. AI will, through precision medicine, enable us to zoom in on those patients whom we believe the drug will work. Make sense? Thank you, everyone.
Please thank Dr. François Nader for us.